So WT1 is a mutation that we see in about 10 to 15% of AML. You can see it both in the newly diagnosed setting or in the relapsed refractory setting. So this was a retrospective study that we did as a collaboration between MD Anderson Cancer Center and Moffitt Cancer Center with about 302 patients, 156 in the newly diagnosed cohort and 146 in the relapsed refractory cohort. And the idea is that WT1 mutations lead to a loss of function of this gene and lead to overall poor prognosis in AML and poor responses to chemotherapy. We found that WT1 mutations in newly diagnosed AML, these patients really do need to go to stem cell transplantation to improve their overall outcomes. The patients who didn't go to transplant overall did fare worse outcomes, especially those with intermediate and adverse risk AML by ELN criteria. In the relapsed refractory setting, we found that these patients, once they acquired a WT1 mutation, really were very refractory to chemotherapy, and only about 33% of patients were able to make it to a stem cell transplant afterwards, which was the only thing that improved outcomes in our retrospective cohort. So with the addition of venetoclax and FLT3 inhibitor therapy, we're hoping that we will be able to improve outcomes in WT1 AML, but further studies are still going to be needed to see the outcomes in that population.